The Florida Stroke Registry began in 2012, initially with an NIH grant. In 2017, the Florida legislature recognized the value of the Florida Stroke Registry and funded this effort. The focus is to improve stroke outcomes through better quality of stroke care, better public education, and ultimately to inform stroke policy at the state level. We have a multidisciplinary group of individuals and stakeholders. This includes state agencies, including the Department of Health, the Bureau for Emergency Management Oversight, hospitals, including 180 hospitals across the state, physicians, stroke coordinators, patient representatives, and many other health professionals.
I think the difference from where we started to where we are today is that we have a larger impact on the state of Florida. When we started, we were a statewide registry, but again now, almost 13 years later, we have a much bigger stakeholdership. So where we were very focused on in-hospital care in stroke, we're now very much more interested and more focused on pre-hospital and post-hospital.
We take the data from the Florida Stroke Registry and we actually merge it with other large state-based data. So we have data that expands across the time period of stroke care. That includes information on who comes to the hospital by ambulance, how quickly they activate 911, the care that they receive by EMS before they get to the hospital.
We were able to identify that there's actually a challenge with calling 911. We did this because we were able to merge hospital data with EMS data and realize that there was actually a gap. If you're looking at just the hospital or just the EMS, you don't recognize that gap in care.
In order to address disparities, whether they're sex disparities, race ethnic disparities, socioeconomic disparities, and geographic disparities, we have to first identify them. Then after recognition comes policies and metrics that we can put in place to address these disparities.
We have identified that readmissions after stroke are very frequent. We are currently trying to understand what are the drivers of readmissions in order to share with our group, with our stakeholders, what are the right interventions to prevent readmissions.
We see in our trends that there have been improvements in terms of how fast hospitals are seeing their patients in terms of stroke and how quickly they're giving stroke treatments. We've had the hospitals come back and tell us, please don't stop. Please continue to give us these reports. It's really helping us see clearly on these reports how well or how poorly we're doing. Also, the reports, what they do, particularly when they're shared among hospital members, is basically it allows them to share best practices.
The Florida Stroke Registry was founded by Ralph Sacco, who left us too early. Dr. Sacco was an innovative thinker. He had the idea of aggregating data in order to inform quality metrics and to ensure that health equity was achieved by reducing disparities. And he did that by trying to elevate stroke care for all.
Initially, for example, when he created the race ethnic disparities dashboards, which are presented to each hospital, we thought that we were great for everybody. But once we saw the data, it then compelled us to look more closely.
Ralph was an incredible leader. He brought all stakeholders to the table, and he was able to imbue them with a sense of purpose that really drove this initiative. There are a number of challenges in front of us. Stroke remains the 5th cause of death in the US and the 2nd cause of mortality in adults at the global level. In addition, it is a leading cause of disability.
We still don't quite understand what drives this overall high stroke mortality rate. So we need further interventions to understand, is this happening in the pre-hospital setting? Is this happening in the post-hospital setting? And then try to understand, how do we close and narrow those gaps? One of the areas that we've identified is around our stroke coordinators. They work incredibly hard, are a great force for change for stroke in Florida, but perhaps they need more resources to get this done.
Imaging is a vital part of stroke care in a sense that even the diagnosis of stroke is predicated on having appropriate imaging. So as part of our efforts, we like to expand the Florida Stroke Registry and add an imaging core whereby detailed neuroimaging information can be added on top of the information we currently have.
The Florida Stroke Registry is at the forefront of trying to reduce the impact and the burden of stroke in our communities by aggregating data, identifying gaps, sharing these metrics of quality with the community across all stakeholders in order to drive an effective system of stroke care.